in your packet. Are there any additions, corrections, or motions?
I did send out a correction. I inadvertently left Pat Peckham off the roll call. He is added on the new one, and I did resend it to everybody.
So moved to approve.
Is there a second?
I'll second.
It's been moved and seconded to approve the minutes of the June 14th meeting. Is there any discussion? If not, all those in favor will signify by saying aye.
Aye.
Opposed, no. That motion carries. Next, we will have an update on our survey led by Eric Giordano in person with his daughter with him to support him, who's been working on this project.
Greetings. Great to see everyone in person, really, honestly. For me, it's been way too long. I'm just going to give a quick update on, pardon me, where we are with the survey. We have today received news that 5,000 surveys went out to random residences throughout Wausau, English versions. So those are out. We'll see if it might take a day or two to get to people, and then we'll start hopefully seeing some returns. We have also made the survey online active. So it's active in English, Hmong, and Spanish. So the first thing you do when you go to the QR code, you'll see on some of the flyers that I handed out, there's a QR code, there's a website. The very first page asks people if they want to take it in Spanish, Hmong, or English. They choose, and then it goes immediately to that language-specific survey. So that is active and live. We are in the process of distributing some paper copies to different groups that we think might be underserved through both the random sample mailing as well as through the online. So, for example, Chad Billup here was gracious enough to be able to take some, or will be taking some, to the jail. Lori Yari has graciously agreed to bring some to Attic and some of those populations, and we're going to be distributing some in the Spanish language community, in the Hmong language community, and elsewhere. So if any supervisor, if any task force member would like to have copies, paper copies of the survey, just let us know. We can print some out in whichever language you desire. And if you think that I think word of mouth is going to be a very powerful way that the survey gets distributed. And if you feel like you want to have a survey on hand to give to somebody, let us know and we'll get some to you. So we're also putting some flyers up around town. Brought Sarah, our intern, who's going to be going out tonight, putting some up all around the city. I've given some flyers to you. If you would like additional flyers, if you didn't get one, just, again, let us know and we'll be happy to give them to you. So we're ready to roll, and I would like to keep the survey open for, a good 3 to 4 weeks, just to make sure that, we're getting maximum return. It definitely pushed our timeline back a little bit, so sorry about that, but we felt it was important to make sure all the ducks were in a row, and I think they are, so happy to report that. Questions or concerns, comments?
So, Eric, then the survey will be out, you'll give them until, do we have a date certain that we can communicate? Or are you looking for us to sort of set that date? 3 weeks would be hypothetically the 21st, 4 weeks would be the 28th. Do you want to just say the end of July?
I think that sounds good. We've sort of been informally saying the 21st. That's what I mentioned to Chad and Lori, but we definitely want to make sure that we have enough time, attention, and spotlight on this. So I think ideally the end of the month would be my preference. But if we want to try to drive people to do something, because sometimes people respond to deadlines, we can definitely put a deadline if the task force would like to do that. If not, we'll stay at the end of the month.
What are your thoughts, task force members? Mike, you've done a lot of surveys.
I think that no matter what deadline we say, we're going to have to add some time to it.
I agree.
So it's silly to, if any insight of, we can do it the next day, it's, you're always going to have we got a few more. I don't have a clear, I mean, I think you're getting at least a month. And then, but part of it's is our numbers. I mean, right, if we get X percent in, then I'd be more willing to say, hey, we can meet, and we're gonna get some outliers coming in at the end, fine, but.
I'm in agreement, and I think in my head, what I've been thinking is if we sort of internally think about July 21st as a date by which we'll start having enough data to see where are we, right? Are we at 500 surveys and we're like 500 short of where we want to be? Or are we at 1,000 surveys, so we're only talking about really needing 50?
So my pushback on that is July 21st is really only 2 weeks, because with the holiday weekend, I mean, you know, I would think that we're looking at the 7th, the 6th to the 7th to be the first day, you know, so then you're at 2 weeks, so maybe even the 28th.
Yeah, not as a deadline. All I meant is that on the 21st, we
Check
start
it.
to look and
Yeah.
see where we
Okay.
are.
That makes sense.
And maybe we need like another kind of marketing push, let's say, around that time. So I agree with you.
Well, if you're like me, you either do it right away or you don't do it. I think there's a lot of people like that. But do we have then we'll need to develop a communication strategy that will maybe put out a reminder and, you know, do a second push with some public education and outreach later. So we would maybe on or about the 15th do a push.
That would be great. And we can do that from a WIP's perspective. I guess the question then becomes, what does the city want to do and how can the city communicate that, you know, to the public effectively?
We can talk about that internally and communicate that back to you. But I think you need that push, that follow-up reminder, and we'll have it on Facebook and other venues, social media venues.
Absolutely. And this probably goes without saying, but I just really appreciate it if anyone here, if you literally know people, whether it's family, friends, encourage them to take it. I think it would be it's actually an interesting survey. I think people will feel it's important. And I think, honestly, the word of mouth is going to go a lot further than a lot of these other things that we're talking about. So,
Is there gonna be a social media post from I mean, because word of mouth is great, but, you know, I'm friends with a couple people here on social media, and I think those distribution channels may have a better organic expansion. Do we have that available to us?
well, WIPS has already posted it
Okay.
on our social media,
Perfect.
but I'm hoping the city will, and hopefully the police department will. And in addition, you know, we're going to be sending we're going to have to do, again, similar to what we did with the listening sessions, we're going to be reaching out to the Hispanic podcast and channels, and we're going to be using our H2N, the Hmong Hispanic Network, also to push this out to those populations. And in addition, we'll be doing some public service announcements on Wisconsin Public Radio and some other venues, So
Eric, the next step beyond the survey is the focus groups. When do we need to really start aligning those, identifying those, and populating those for the next phase? Because we're starting to get into fall, and we need to, you know, as a committee, complete that step 3 of the 4-step public involvement process. So you have any thoughts on the focus group timing?
yeah, so I think realistically, we want to have enough data from the survey, which, as we're talking about, is going to be the end of July, realistically, to be able to kind of look at and see, well, who are we missing? Like, which voices did not necessarily participate as much as we anticipated, or even just looking at some of the preliminary results, and which we'll share with this committee, or the task force rather. You may look at some of the responses and say, you know, this is something I didn't expect, or here's an area of interest that we would like to know more about, that you know, we'd like to do focus groups with particular populations. So part of that is honestly going to depend on what the data shows in terms of, so I'm a little reluctant to sort of say, well, we could anticipate that there might be certain groups we'd like to, organize in focus groups, but until we really see the data, I personally would not recommend that we jump to any conclusions about who we should speak with. So we're really looking at August to get these focus groups organized.
I think we've identified some groups that we have committed to, such as law enforcement and some others, and I think we've begun, so we could perhaps start working on what those groups might look like, so we're not doing everything at the same time.
And we'll follow your direction. So if you, and I do recall that we did talk about law enforcement groups, so yes, if that's a group we're already committed to, absolutely, we can start working with the chief and perhaps organize one or two in that space. And if there are other groups that you're already know ahead of time that you'd like us to do, we can start organizing that, and we'll just follow your lead on that.
Any other questions of Eric and his staff, his great staff?
No, other than just thank you for your work, your staff. Really appreciate it.
Thank you. It's been a pleasure doing this with you.
All right.
Okay.
Thank you so much.
All right,
And you'll
thanks.
be printing additional surveys for others?
We will,
Or-
but we're kind of taking orders, I guess. So we have a few, for example, we know we want to, there's a few Spanish language surveys we want to put in certain locations. There's a few locations we've identified to put some Hmong language surveys. So we do have to print a few more, but really a lot of it's going to depend on demand. So if the mayor, I gave her a bunch, if people somehow come into the city and are looking for the survey and she runs out, give me the order. Same with the sheriff's office or the police chief or anyone else, or any of you that would like additional surveys, just let us know.
Thank you.
Okay,
And
thank
again,
you.
thank you to your team.
All right, I'll pass it on. Thank you.
All right. Next, we'll move on to, at the last meeting, we indicated that we would be inviting representatives from the Sheriff's Department, the Diversion or the Justice Systems Coordinator, and the District Attorney. Teresa couldn't be here today, and I think we'll probably fill the evening with the speakers that we do have and the topics that we have. So she would be available at our next meeting to talk about the District Attorney's Office as well. So with that, we've asked Chad Billup to give us an overview of the county jail and how the Sheriff's Department fits into our discussions.
Thank you, and good evening.
And thank you for coming.
Oh, not a problem. I'm very happy to be here. Well, my name is Chad Billup. I am the Chief Deputy at the Sheriff's Office. I've been in that role since 2013. My job is to oversee all of the divisions within the Sheriff's Office, and we have 5 of them. We have our Patrol Division, which is our most visible division. They're much like the Wausau Police Department, and we have uniformed patrols out on the streets in mostly the unincorporated areas of the county, with the exception of a contract that we have with Rib Mountain. We have an administrative division that handles all of our records, a communications division that is the 911 answering point for Marathon County, all Marathon County law enforcement agencies. We have an investigations division that does just that, investigates the crimes that are referred to them by the patrol division. And the division that you're interested in tonight, the corrections division, which is the Marathon County Jail. Now, what I want to do tonight is have an opportunity for you all to ask me as many questions as you want about the jail, and I don't want to give you information that you really don't care about. I want to make sure that we tailor this to you and what it is you want and need, and if I don't have the information available tonight, I would be happy to bring it back at another meeting. As a quick overview, the Marathon County Jail, the Corrections Division, is the largest division within the Sheriff's Office. That is where we have the vast majority of our employees, and we employ somewhere in the area of about 85 to 86 staff in that jail. The majority of them are corrections officers, and they can be assigned to either the main jail, the Juvenile Detention Center, which houses a secure detention, as well as the Marathon County Youth Shelter Home. So we're responsible for all of those. We are regulated and monitored by the Department of Corrections at the main jail, as well as the Department of Health Services and the Department of Corrections out at the juvenile facility. In addition to what you would envision as the uniformed members of our staff in the jail, we have other people that work for us either directly or through contracts. I don't think many people realize that the jail is like a little mini city, that we have food service that comes in, we've got medical services on site. We hold church in the jail if there are inmates who want to have religious services. We do a lot of programming within our jail. We actually hold a welding program through North Central Technical College and provide HSED, GED training. We actually have graduation ceremonies that take place in the jail once or twice a year. We have a social worker assigned to the jail. Her primary responsibility is discharge planning of inmates that are leaving the facility, as well as working with them on their educational goals and helping them leave that jail hopefully in a better place than when they left. And one of the key pieces that she works on is ensuring that they maintain their Medicaid or Medicare status after they leave our facility. Because what recently changed with state law that was pushed by the Badger Sheriffs and the Wisconsin Sheriffs and Deputy Sheriffs Associations was when we had inmates that came to us, they lost all of their benefits. Their Social Security was froze. Their Medicare, Medicaid benefits, if they had those were frozen. I shouldn't even say that they were just terminated. They were gone. And what we did was we moved to have those froze so that when they leave, they can resume those benefits, because our social worker does a lot by way of reconnecting people with either medical doctors, mental health practitioners in the community in order to make sure that inmates leave again in a better way. We also have nurses and physicians available in our jail, but that is not a 24-hour service. We staff that about 18 hours a day, and that's because overnight there's very little need for those services right now. On any given day, we should probably talk about what the Marathon County Jail looked like pre-COVID and what the Marathon County Jail looks like in a pandemic situation. If we think back to late 2018, early 2019, the Marathon County Jail had a population of close to 431 inmates. Our max capacity in that jail, if we were to completely fill it, we can put 279 people in that jail. The reality is the state never wants us to be at that level because that means we have no room to move inmates about the facility. So we try to maintain a population in that jail of about 250 inmates. There was a time in 2019 when we were housing out about 130 inmates a day to other counties. We had them in Lincoln, Langley, Taylor, Winnebago, Columbia. I believe that was it at that time. And the cost of doing that for the citizens of Marathon County was right around $1.5 million. Just the cost of housing those additional folks out in other communities. At that time, when we realized that was happening, we began a process working with evidence-based decision-making groups with our local police departments, and we came up with some different strategies. One of those was a program called the Proxy. The Proxy was a tool that our officers used on the street in order to assess people that we encountered and worked with to determine the likelihood that they would come back to court if we didn't take them to jail. And although we inherently tend to do that, I can tell you that over time and through the years, we've gone away from it. I've been in law enforcement now for going on 28 and a half years, and when I first started, I worked for the Colby-Abbotsford Police Department on the far west end of this county. And that's a police department that's split in Clark and Marathon, and if I made a decision to arrest, I was either going to Neelsville or I was coming to Wausau, and the instructions from my chief at that time was, you only take people to jail who absolutely have to go to jail, because they didn't want you out of town for a period of time. Well, it's a lot different when the county seat is where your metropolitan area is and where your majority of your police departments are, and quite frankly, jail can be an easy, quick decision. If you're in a, especially when you're running from call to call to call, it's a quick solution. Well, what we did was we took a step back, and through the work of the Wausau Police Department and the Sheriff's Office, we were the two that piloted it, we made a significant difference in the number of people that were being incarcerated in the jail. And our jail population slowly and steadily started dropping, which was really good. We got to a point where we were only housing out 60 to 70 inmates a day. That was a big step forward. Well, then the pandemic hit. And
If I can ask a quick, before, so what percentage of people were you using like electronic monitoring alternatives separate from outside institutionalization?
that is a great question, and here is the problem. Electronic monitor is reserved for people who are sentenced. Marathon County, as we're going to talk about here in a little bit, has a very small number of people who are sentenced to the Marathon County Jail. Most people in our care are either there on a probation hold or they're there pre-sentence, which means they haven't even been to court yet. So we're trying to do something a little bit different, and Laura's going to talk about that after I'm done, about a brand-new program that just started a week ago that might afford more opportunity, but we didn't have any inmates to put out on electronic monitor. As a matter of fact, we just ended our Huber program because we don't have any inmates to put on Huber. So bad that we didn't have any inmates to do what we would call inmate labor, where they help with laundry, clean floors, do those things, and they receive credit off of their sentence. Quite frankly, there were just no sentenced inmates. The court system in Marathon County moves very slow. And we can discuss that more, but the vast majority of our inmates are not eligible to be on electronic monitor. At that time, anywhere between 18 and 20 was a pretty good average. I can tell you that today there's 26 people out on electronic monitor, and that's maxing it out, and that's because we don't run Huber anymore. I'm trying to remember where I was at.
You were right at the pandemic, right?
Oh, okay, so the pandemic hits, and for a while there, we were managing pretty well with controlling who was coming in and trying to be careful with officers. They were masking. We were having inmates as best we could mask, and we were doing quarantining within the jail, but one inmate got through, tested negative when they came in, didn't present symptoms, was put in a block, and COVID ran through a block within the jail. And that then shut down a lot of the things that we did in the jail, and we had to stop taking the intakes we were taking, and we put pretty strict restrictions out on agencies about who we would accept and who we wouldn't accept. And we largely went away from any minor violation, probation violations for things like no drinks, if you were contacting somebody you shouldn't, or had an associate you shouldn't be around, it was notify the agent or have them notify their agent, and we would deal with things that way. And that jail population started dropping. Our jail administrator at the time cautioned me, and she said, this looks really good right now, but what's going to happen is, since court is not running, you're going to have these people that are coming in on probation because the administrative law judges at the state were able now to get caught up on these probation holds and violations, and they were starting to sentence inmates, and now our sentenced inmate population started climbing. The issue was those sentenced inmates were all sentenced to prison, not to county jail time. So the prisons weren't accepting anyone, and now we filled up our Marathon County Jail with inmates that were due for prison. So working with some different organizations and with Secretary Carr at the Department of Corrections, it took several months, but we ultimately had that cleared up, and a lot of those inmates were moved out of our facility, and we're now able to accept a few more. As we're coming out of the pandemic, and I should go back, our population in the jail during that time, right around 180 to 200, it would fluctuate in there. And it's holding there right now at this time. We only have today 8 people housed out in other counties, and that's because those people were housed there during the pandemic. And instead of risking bringing them from another jail to ours and risking contamination, spreading of the virus, we're just going to hold them in those other counties now until they actually have to come back for some reason. So our numbers right now are doing really good within the Marathon County Jail as far as the census goes, but we are now slowly coming out of the pandemic, and we are beginning to open up options for police departments to bring people in for things that in the past we wouldn't have allowed. And we've put out strict instructions about the risk that we face in the event we overwhelm the system, not only for the jail, but also for the courts. And we've been working with the Marathon County judges in order to use the jail somewhat as a check valve for what's coming in and out of the criminal justice system, because it's not just going to pose a problem in the jail, it'll pose a problem for the entire system. Now that the judges are up and moving, more jury trials are taking place, we can already see that some of these cases are moving and it's beginning to normalize a little bit for us. The issue is there are a lot of people sitting in the jail pre-sentence, and there are a lot of people out on the street right now who are pre-sentence, and all those cases need to make their way through the circuit courts. So the potential remains that if we can't keep working with Department of Corrections, that jail could fill up again, and we're right back to where we were before. So right now, it's pretty efficient, but we run the risk of going back to where we were pre-pandemic, and that's not someplace we want to go. So that's an overview of the jail and kind of the history of the jail and where we're at right now with our population. And I'm certain that you have a lot of questions that you'd like to ask, and I'm here to answer those questions as best I can.
Can you repeat how many people are in the jail at this time?
Today, we have, in our care, we have 240 people. Now, remember, the jail can only hold 279. All of those people, when I say they're in our care, they might be on electronic monitor.
Okay.
They might be in a different county. So those 8 people physically in the jail today, there are 200.
Okay, and then how many people were working there as counselors or social workers?
We have 1 social worker and 1 forensic mental health therapist.
In your opinion, do you feel like that's enough people to be providing mental health care to that population?
Our social worker is not a mental health therapist.
Okay.
She's a social worker who helps connect people to resources. So she's not, to your point, she's not providing any mental health resources. I will tell you, no. Mental health resources are something that are extremely hard to come by, and a qualification for jails is that they be a forensic mental health therapist. And I would bet that there are maybe 1 or 2 other jails in the state that are doing what we're doing. And we have a full-time, 40-hour-a-week mental health therapist assigned to us from North Central Healthcare. So could we use more? Absolutely. The issues that Danny, her name is Danny, that Danny deals with are extremely challenging cases. The one thing that I didn't mention is of these 240 people, there are currently 3 or 4 of them that are housed at either Mendota, at the mental health hospital, or at Winnebago Mental Health. So those people don't get out of our facility without someone like Danny and get to a higher level of care, because North Central Healthcare is not designed to house people who are incarcerated.
Right.
Now, they will, don't get me wrong, North Central has a number of times taken inmates that are low risk, and they will care for them locally, but a number of them, without Danny's help, would never get to a higher level of care, especially when we're trying to get people ready for competency.
Okay. Thank you.
Yep.
So can you talk, last week when we talked, you talked about the number of probation people that were in jail relative to probation violations. Could you go over those numbers for us?
Sure. Today, so I pulled fresh numbers just from today. Today, we have people on probation. There are 50 people within the jail that are being held on some sort of a probation hold. They may have just a straight probation hold, or it could be a probation hold with new charges. So the way our data flows, it can be an overlap. So right now, there's about that many. I will tell you that we have pretty strict protocols in place with probation right now. As a matter of fact, I was working with them today on what that will look like when they want to start bringing more people in. What we've done with them is we allot them right now, because of the pandemic, 5 beds that they can use however they want. So if they need to bring a client in, they had a situation last week where they had a client who, this is a vulnerability in our community, this is something, a need. They had a client who needed to detox for 72 hours before that client could go to treatment. There is no detox in Marathon County. No one provides it. So the only option they had, and we told them, we don't like it, we get it, but Marathon County Jail is not a detox facility. When somebody's going through withdrawals, that should not be in a jail. And our nurses are trained in it. They have doctors that are available to them, and we have the medications to help manage it. but we actually brought a person in off the street simply because they needed a detox and had nowhere else to go. Now, North Central has plans with their renovation that they're going to reopen a detox program, but this has been a huge void in the community for years, and we deal with that daily, people who are detoxing.
Chad, can you walk through us how people or inmates are presented to this system? So, obviously you deal with all of the law enforcement agencies in the county. So can you walk us through the process that one would go through to get into jail?
So that's your question, Supervisor Robinson, that is very much dependent upon the agency and the individual officer and their own discretion and the policies of the agency. If I want to talk about the sheriff's office, we have pretty strict rules, and I will tell you that from my observation, the Wausau Police Department has been very consistent with what we're doing. We're going through a system very similar to that proxy. We've now stopped the proxy. Deputy Chief Barnes and I met with some professors from UW-Madison and talked about the validity of the proxy. Is there a better way to do the proxy? And ultimately, we decided that we can make those decisions and still make appropriate arrest decisions by doing something different. So, in essence, we have contact with someone on the street, and we're trying to assess a couple of different things. Number one, what's the likelihood that they're going to reoffend? If they're going to be, let's say, downtown, and they're going to continue to pick fights with people that are walking down 3rd Street by the 400 block tonight, and they won't stop, and we've tried hey, you need to leave, that doesn't work. We've tried a citation or thought about a citation, that's not going to work. They're just going to continue to pick fights, and the only option is to make an arrest. That may be one way they get into the jail. Officers have a lot of discretion in the decision that to initially incarcerate for that initial offense or not. Once they're brought to the jail, there are rules that have been set in place by our local courts as to what bond should be or how bond should be set. So we have a protocol or a matrix, if you will, of determining whether signature bonds are appropriate or we should be looking for a cash bond. If we decide we're going to hold on a cash bond, those folks are held for up to 72 hours, and there's a review by a judge that will call in, or if it happens to be during the week, they'll actually go to court the next day and have bond assigned by the judge. So people getting in can come in from law enforcement from an initial violation. Once we've made an arrest and that person's already been through their court appearances, oftentimes they're placed on probation. And I think it would be interesting for you to understand more about probation. I don't have the exact numbers for the number of offenders in this county. Right? We call them offenders, the people that are on probation. Those folks total well over 2,000, pushing 3,000 people. And if a probation agent decides that that person needs to be brought to the jail for some reason, whether they're going to revoke their probation status or they've got to do an investigation into an allegation, they can also be brought into the jail and be part of our population.
So on any given day, how many of those initial appearance individuals, what does that make up of your jail population?
People that are just being held for court the next day?
Right.
Today it's very low. Today, I would say that we average on a normal day, a weekday, 5 people. Pre-COVID, 13 to 20. It would depend. The rules today are very different than they were a year and a half ago. On a weekend, our largest weekend run here since we started opening things up, I think we had 12 people that were held over the weekend to be in court on a Monday, and that was just a couple weeks ago.
So you talked about efforts in sort of reducing some of the population. So I have kind of 2 questions. One, you had mentioned earlier about the Huber program, and sort of pre-COVID. I was wondering now, as sort of things are getting back to normal, is that something that you're looking to revisit? And then also, you had just mentioned about bonds, which I wanted to just get your opinion in terms of cash bonds, and if you feel that there should be some reform there.
So your first question, I want to hit the cash bond question first.
Okay.
That is probably one of the more contentious debates that's taking place right now in the criminal justice system. I will tell you that in anticipation of coming here today, I started taking a look through why people were held in our jail. What were the types of violations they were being held on, which are cash bonds? And I didn't find anything where I went, I wonder why they're being held on that much cash. The types of violations we're seeing here in Marathon County and the people that are being held here on some very serious charges. The number of people that are being held in our jail right now on homicide charges, reckless homicide, manslaughter, those cases are not moving. There's a lot of people in our jail with those types of charges right now. If I saw a tendency within our current jail population that suggested that we needed some sort of change to cash bond, I will tell you that from managing a jail population standpoint, if we were having this conversation a year and a half ago, I would tell you, without a doubt, we need to start talking about reforms to cash bond. Bond should only be used for ensuring a couple of things. Number one, that the person's going to appear back in court again, that they're not going to pose a danger to the community. If those two prongs, basic for the most part, are met, I think that they should be released. I don't believe that they need to be in our jail. In looking and examining our population today, I believe that the way our judges are handling cash bond here today is appropriate. Some of these offenses are pretty darn severe. And I'm sorry, your first question?
Sorry, and just to follow up on that one, do you think, but you said you've noticed a change, do you think COVID sort of heightened that change in terms of judges looking at that?
Oh, absolutely.
Okay.
The judges are very much aware of the risks that COVID posed in the jail in communal populations, and they were doing their part in order to examine that as best they could and make appropriate decisions.
I think what would be interesting with that is to sort of see in real data moving forward, sort of, really over time, if really the changes have been, made to a great extent. I
I
trust your
agree.
opinion, but I mean in terms of making sure.
That they're appropriate, that
Right.
those bonds are appropriate.
And then the first question was about the Huber program. You had
I'm sorry,
mentioned having used that before. It sounds like it was somewhat successful before COVID, and then obviously COVID happened. Is there a move to kind of go back to some of that?
The answer to that is yes. I believe that the sheriff's office would go back to that if we had a sentenced population. If there were enough people in our facility that would warrant the resources that it takes to run a Huber program. There's a lot of staff time that's involved there in order to make sure that they're doing job search, going to their job, following up. Their employer sends their check to us, not to them. We do a lot of things with it's a big program. But when you've only got 2 people and you're assigning staff to that, it's not a good use of your resources. Those folks, we put on electronic monitor. So there's opportunity there as well to ensure that we're using those resources well. If we had a large sentence population, absolutely, I think we should be looking back at Huber again. Would you like a little rundown on what the population looks like today? All right. So today, sentenced inmates, let me pull my totals here. Total sentenced inmates in the jail today, there are 40 of them. 26 of those folks are out on electronic monitor. The other 14 are likely people, no, they are not likely. They are people who are just waiting to go to prison. So anybody that can be on monitor is on monitor. So they're waiting transport. There are 140 people that are just sitting in our jail waiting for their day in court. There are 50 people on probation holds. There are 2 people that are in for contempt of court, which means that they need to see the judge, and that must be some sort of a warrant that they're being held on, and 11 people on detainers, which means that we may have a reason to hold them, but there's another county or jurisdiction that also wants them. So they're just on a detainer with us until we can facilitate their movement. The total of 140 pre-sentence is a large number. A lot of those folks, when you look at the total number of days they've stayed with us, I'm going to pull up another resource here real quick. And what this is the jail every 2 weeks runs what's called a hot sheet. A hot sheet is a communication that we share with the circuit courts and the district attorney's office about the people that have sat the longest in our jail. So of the group of people that are sitting and waiting, the average length of stay waiting to go to trial is 486 days. That's a very long time. County jail is designed to hold people for no more than a year.
So of that 486 average days, what is the number of people that were used to drive that average? Is it 20? Is it 40? Is it?
On the given day that this was run, I believe they ran the whole group for us. So I can just, it's a spreadsheet that drives it. I just got to get to the bottom of that spreadsheet. On that given day, there were 210 people that they were assessing for length of time in the jail and awaiting some sort of trial.
So that, is that 486 days reflective of the 210 or of a subset of that? You said the hot sheet. So the hot sheet would be a subset of that 210?
It is. And I don't know exactly which defendants they used in order to do that.
And just for clarification, my understanding is that if you're sentenced and the sentence is less than a year, you typically wind up in jail. If the sentence is longer than a year, you go to prison. So that's sort of, based upon felony, misdemeanor, and length of sentence.
Correct.
So we have people that are on that hot sheet that are in county jail longer than they would be if they were sentenced in court to jail.
Correct. We have a number of people who have gone and had their cases taken care of, and they get time served. And they may be sentenced to 9 months, and they would have actually sat 2+ years.
I have a question. So if an inmate is having a mental health crisis, who can they talk to if there's only the one mental health counselor and they're not there at all hours of the day?
Great question. We have a number of our staff who are trained in CIT. That's Crisis Intervention Team. We have officers on the street that are trained in that, and dispatchers. And those CIT-trained corrections officers are the ones that would have the initial contact with them. And if they assess that there is a bigger need here, we call mobile crisis from North Central Healthcare, and they bring mobile crisis workers up to the jail. And then they make a determination as to whether or not we need to take that person to a higher level of care, like North Central or Winnebago or wherever it might be. Or if the person's stable enough, we just refer to the mental health professional when she comes in the next morning, depending on when that takes place.
Do you also have any psychiatrists under contract for?
With this company that we have a brand new medical provider. We have a tentative contract with them, but I was approached by Dr. Guthrow from North Central Healthcare, and Dr. Guthrow wants to bring in some new providers that are going to be starting at North Central Healthcare in the next couple of months. I think actually tomorrow, like July, is when these providers are coming in. And Dr. Guthrow has an idea that he would like to start a program where those psychiatrists actually visit the jail on a regular schedule and then work with those highest needs inmates that have been with us and we plan to have remain with us, and then can see them through the whole continuum of their care. So right now, we're waiting for, so number one, the jail administrator will be back from her leave. She's went out on family leave, but she will be back next Tuesday. And she is going to be coordinating with either the current medical provider, depending upon timelines with North Central Healthcare, to provide psychiatric services, or we were going to be going with a more permanent solution with North Central Healthcare, where they would have doctors on site for us. The reality is, if we need a psychiatrist now, we've been working with Dr. Guthrow from North Central Healthcare, or Dr. Aders.
Pat?
Oh, Chad.
Hello, sir.
There's, in the past years, there's been kind of a common belief floating around that a lot of the people who are in jail are only there because they violated probation by going to their neighborhood tavern and having a beer, and somebody phoned the police and they're, in jail for that. How have you dealt with that, especially in the COVID thing, and to be sure that probation revocation or probation holds are legitimate and justified?
So the sheriff's office does not make a determination of whether or not a hold is justified. That's not our place, not our job. We trust that they're making good decisions and they're bringing people in for the right reasons, but those individuals are actually the responsibility of the Department of Corrections, and they make those judgment calls on whether or not they're appropriate for being brought into the facility. I can tell you that in working with probation and parole through the pandemic, they have been excellent about working with people on what we would call a simple rules violation, something like what you're describing, and that they're bringing people in that are appropriate who have higher level violations. Now, your question leads to yet another example of where decisions within the Department of Corrections can impact local municipalities, like Marathon County, like the sheriff's office. In the past, it's been pretty standard that probation agents will work with their client and do the best they can, and if they reach a certain point, they will move for revocation status on that person. And it's been kind of a discretionary process. What the Department of Corrections will be moving to, and I think the pandemic slowed it down, but it's likely going to come, is they're changing their methodology, and they're going to be relying more heavily on sanctions as opposed to revocations. And what they want their agents to do is use local county jails as sanction points as opposed to moving so quickly to revocations. So it's entirely possible that a person can get 5 days the first time, 10 days, 20 days, 30 days, 60 days, 90 days, 120 days, all county time, and they can delay that revocation process. And it may sound harsh, but from managing a county jail perspective where we have limited capacity, by doing that, all that time that they're spending working on this gets pushed back off onto local resources, when in the past, those folks likely would have at some point earlier in the process gone to prison. That sounds bad from our perspective by saying that, but that's the reality. And what's going to start happening is the county jails are going to start filling up faster and having it become more of a local problem.
You find it's the sanctions, to the best of your knowledge, are sufficient to get somebody's attention? I would think if somebody said you have to go to jail now for 3 days, that would get my attention.
What I will tell you is that probation and parole deals with the same issues that our local police departments and the sheriff's office are dealing with, which is we're dealing with the same people a lot. There are a lot of people on probation in this county that you will never hear from. They get sentenced to probation, they follow the rules, they work with their agent, and may never have contact with them again. And that's great. The people that we're interacting with are the people that struggle with that and can't follow their rules with their probation agent, and those are the ones that keep cycling through, just like the folks that the Wausau Police Department are dealing with. It's a lot of what we call high utilizers, the same people who keep cycling through over and over and over. And when I look through the list today, a lot of names I recognize, and a lot of names where I go, oh, I know their dad, or oh, from the days when I worked the road. So it's cyclical, and I believe there's family dynamics that play into so much of this. It's a societal issue.
How can an inmate make a grievance or complaint against staff workers?
We have kiosks in every one of the blocks, and they are not maintained by us. The back-end software is off-site. So that's the checks and balances to ensure that no one can make an allegation and have us go, we never got it. It's an independent party that holds that data. In the past, it used to be, I say past, I'm talking like 2015, so not that long ago, it was just you took a piece of paper and a pencil and you wrote your grievance, you handed it off, and then it was a he said, she said whether or not we received it. Now they're all tracked electronically, and then we have a checkoff system for how we address that grievance.
Okay. And also, what's the minority population for the Marathon County Jail?
I thought you'd ask that. So, of the 240 inmates that we had with us today, or have with us today, 41 of them are black, 25 are Asian, 6 of them are Native American, and 168 identify as white, which can include Hispanic. We have other ways to break it down even further, but that's the easiest look that we have at it. I broke those down by percentages, and with removing the decimals and getting close, the black population is about 17% of the jail population. Asian is 10%, Native American is 2%, and white is 70%.
I do have a question related to that. So now that when we're talking about cash bonds before, you were saying how you have seen some differences in sort of more serious crimes in terms of being there. Have you also started to see any change in terms of then, therefore, the makeup, the general composite in terms of people that are there, in terms of race or anything like that?
Ironically, it stayed about the same. Pre-pandemic to now, it's very close. There is not a real hard and fast, you could say, oh, this changed overnight. We didn't see that.
Also, you had mentioned, obviously, the long wait of some people there in the jail. I know a lot of that has been, I work on the civil side of the law in terms of cases being pushed back because of COVID. Are we seeing any significant improvement now that things are changing? I know Marathon County started taking, even us coming back to court. Or does that still seem like a long road ahead in terms of starting to get people out who shouldn't be there that long?
That problem was a problem before COVID. We were tracking that pre-COVID. So there is no change there. I will tell you that it's nice to see the courts getting back up and running again, and I am seeing some movement from the courts on the population that we have, but that issue of cases moving slowly has been a problem for a long time.
Can you go into the reasons why you think that happens?
There's a lot of reasons. The majority of it has to do with, I'll call them judicial proceedings, and the work of attorneys on all sides and how they work their cases back and forth, defendants asking for new counsel. It runs the gamut. And I will tell you that I've been working with the district attorney's office and trying to identify why that is. And I really believe that Teresa Whetstone is the best person to answer that for you when you meet with her, because she's in that every day. I hear about it every day, but I'm not in it every day.
And again, she will come to our next meeting with her staff and her programs.
I'm sorry, one other question. You had mentioned before about constantly seeing a lot of the same people in this cycle. Is that in terms of crime, or is that due to drugs, or?
It's all the above. I will tell you that in my experience, a lot of it has to do with mental health and substance abuse. And I think that they're interchangeable and they drive each other. And a lot of the people that we interact with struggle with those. And the way that our laws are structured, both state and federal, and I agree, being mentally ill is not a crime. But the challenge is we cannot force mental health treatment on people. They have a choice. And because that's how things are structured, law enforcement struggles with that regularly. The reason that the Sheriff's Office and the Wausau Police Department partner on a crisis assessment response team is because we've recognized that. And back in maybe it's 2016, 2017 or so, we worked with North Central Healthcare in order to try to address some of those populations, and it's made a significant improvement. The work that the Wausau Police Department is doing today with their homeless initiatives is a direct result of much of that. And we can tell you that the work that they're doing on their homeless initiative is definitely having an impact on the jail, a positive impact. So I think that what really drives much of what we deal with is substance abuse and mental health. And until we get a better handle on that, you're going to see this, regardless of race, you're going to see this continue.
Go ahead.
Sorry.
No, please, this is the time to ask the
Yeah.
questions.
So, kind of two questions, could be related. So, on one end, because we are a task force, and we're looking at how to, improve things if there are places. Is there any places that you feel that the Sheriff's Department needs more support, things that could be done better in terms of improvements? And then what is, as we talk about mental health issues, we can't leave out the Sheriff's Department officers as well in terms of what support they have in terms of those resources.
Sure. Great points and a great question. I think that mental health resources, throwing enough at it is going to be the problem. I don't know that we can, as a community, afford to do what needs to be done here. I think that expanding the CART program, whether you do it with the Sheriff's Office or you do it with the Wausau Police Department, that needs to happen, without a doubt. And I will tell you that the metro area here, not just the city of Wausau, but Everest Metro, Rothschild, Cronenweder, that Mosinee, that corridor, they need more resources in this area in order to provide more directed mental health intervention. And pairing with that crisis worker makes all the difference in the world. So it's not just funding your police department, it's funding mental health resources to support them, I think will be a big impact. I think that as far as our officers are concerned, we've put a lot of resources in place. Much like the Wausau Police Department, we run a peer support program. We have additional resources that the Sheriff's Office contracts through a vendor that in the event they are having a need to talk to someone, it's in addition to our EAP, it's an additional number and practitioner that they can call that they trust and has worked with us. They can reach out to them. We have chaplains available to us. Our staff has, to the best of our ability, the resources that they need. And as we find more opportunities, we continue to bring those in from a wellness perspective. But I can't drive home enough the need to have mental health resources. And if anybody said to me, you want more mental health resources in the jail? The answer is yes, without a doubt. It's just that I know that is from a county perspective, from a North Central Healthcare perspective, is a very costly endeavor, no doubt about it.
Can you repeat one more time how many nurses are on staff there?
It depends on the time of day,
Okay,
but usually during the busier, we'll call them when inmates are up and we're doing med pass and those things are happening, I believe there's 2 to 3 nurses at any given time.
and that's enough to be able to get meds for everybody?
Yes.
Yeah, okay.
We've got a pretty good system now with the new provider, barcoding, things like that, so it works well.
Sure. So I work in the inpatient hospital at North Central, and I'm just wondering what is the criteria for inmates, I guess, being severe enough to get to go to North Central? Like, is it just as soon as they start making suicidal comments, or not necessarily?
The state law, we were, I want to be careful about how I say this because I want to get to your question but I want to share my frustration. We've been down this road a number of times with different groups about what constitutes a mental health emergency. When does someone need help? And state law is pretty darn clear about a 5115 in the criteria that they're a danger to themselves or someone else, and they're an imminent danger. What is very frustrating, not only for the jail, but for street officers as well, is when we show up and we make a determination that this person needs help, and we're told, no, they're fine. No, they're not fine. I'm standing in their house, the house is destroyed, their kids are in the corner crying, and somebody else on the phone is going to tell me, it's okay, you can just leave them. Same thing goes with inmates. We see what those inmates are doing every single day. We see their good days, we see their bad days. And when we come in and say this person needs help and we're told they're fine, that's frustrating. And that happens all the time. It used to be, back in about 2010, law enforcement officers were given the discretion to make a determination as to whether or not they believed a 5115 was appropriate, a mental health detention. That law changed for some reason, and now the criteria is we can make a determination that something needs to be done. We have to get on the phone and call a practitioner, the crisis center, and describe what's going on or hand the phone over, and our opinion really doesn't matter. The jail officer's opinion really doesn't matter. When we think that there's something wrong and nothing happens, that's frustrating. So it happens all the time.
Yeah, that is frustrating. And you know, when I talk to patients, that is something I hear all the time about how, like, they knew possibly upwards of like a month, 2 months ago that they were really deteriorating, you know, and it wasn't until they finally actually physically tried to kill themselves that they got to get services, you know, and at that point, like, it's a lot of picking up the pieces and reactive versus proactively helping someone.
You are spot on. And so much of what we're left with is reactive, and there aren't nearly enough proactive resources. And that's what needs to change in the jail and on the street.
Sure. I have a question. Do you guys have solitary confinement in jails, or is that just something that happens in prison?
Nobody calls it solitary confinement. They call it administrative segregation. We do have a cell block that we have available to us in the event we have an inmate that just can't be by anyone else, or someone who's suicidal and no one will help them, and we have nowhere else to go. We put a suicide vest on them and we set them there because we tried to get them help and no one would help them. We also have a chair that we strap them in. When we say this person really needs help and no one will help them, we strap them down. Not good. But we deal with that, I'll ask the chief, every day. We ask for help and we don't get it.
And why is that? What's the standard?
Other people make the determination that we haven't met the legal standard for that.
So the legal standard is defined as,
They are a danger to themselves or someone else, and then you have to articulate what that danger is.
so how is that quantified?
Well, when the officer stands there and describes, they destroyed their house, they did this, they did that. Have they been drinking? Yeah. Well, that's probably because they were just drinking. Maybe if they were sober, well, why do you think they're drinking? They're drinking because they're having a rough time. So when I'm standing there and I'm trying to articulate the best I can what the problem is, and someone else is on the other end of the phone making a determination, and I have no control, that's the problem. We need true mobile crisis across the entire county. All the time. When we call, we need you. That still doesn't happen. If I need you in Athens, I need you in Athens. That doesn't happen.
How often does it happen?
Crisis calls?
Mobile crisis availability? Is it,
I could tell you from a sheriff's office perspective, rare, if ever. City, I believe you get a little bit more.
A little bit more. It's still pretty rare right now, though. And that, to Chad's point, that's exactly why. The mobile crisis isn't available very often. Probably more to the city than it is to the sheriff's office, just because of where it's located. But, I mean, the point that Chad's making in regards to the crisis assessment response team, if we have crisis professionals working with our police officers, with our sheriff's deputies, it makes all the difference in the world. The statute is designed to be a collaborative approach between law enforcement and mental health providers. And so, but it's frustrating because law enforcement is standing on scene. They're seeing what's going on. They've got a rapport built. They've done the investigation into the background of the incident and what's transpiring. And so, trying to relay everything you've done in the last 30 minutes or the information you've gathered in the last 30 or 45 minutes on scene isn't easy in a 3-minute phone call. So to have somebody standing there seeing what you're seeing makes all the difference in the world. And I would say it's trauma informed. It's the best approach for the citizens that we serve, which is have that person, have the mental health professional right there with the police officer, with the sheriff deputy. That's trauma informed. That's best practice. That's what we should be doing in our community for people that need our services.
So I have a question about that, because that, really concerning. Is there one particular place that you normally call, like, is it just North Central Healthcare? And then also, have there been any efforts to maybe have a collaborative meeting to talk about sort of these issues with those entities?
Hours and hours and hours of meetings. That's what I do. Today I was on a phone call with Wisconsin sheriffs and deputy sheriffs and Badger sheriffs because a recent problem we are now having, and it's a partnership with North Central. Actually, I've been working with them on it, is medical clearance for people. Medical clearance, when you're trying to get somebody treatment and they have to sit in an ER for 8-10 hours, is not good for them when they're in crisis. They need to see somebody for help. That's been a reality for a long time, and it continues. We have tried everything. The Wausau Police Department, because I know that's what we're here talking about, has been a phenomenal partner. Deputy Chief Barnes and I would love to know how many hours we logged together in 2016, 17, and 18 trying to address this, building the CART team, building a CIT program. We actually invite North Central Healthcare's crisis workers, and I don't know how long you've been working down there, but if it was starting in 2020, we haven't had any CIT classes because of COVID. But prior to that, we invited North Central Healthcare's crisis workers to come to a CIT class with us. So we trained together, learned together, so we all were on the same page working. And we'll put 28 police officers in a classroom. We'll go up to 30, but we like to reserve at least 2 spots for North Central. If they want more, we'll give them more. But the turnover in that crisis center is crazy. You're asking people to do an incredible job with very little training and a lot of decision making. And at the end of the day, it's not the crisis workers' decision. A lot of times they appeal to a higher authority within their organization. And even though that crisis worker agrees with the officer, it doesn't matter. You're nodding your head. Yeah. So I think that our officers are doing everything they can to advocate for people, and I think you're seeing me get a little amped up about this, and that's because I'm passionate about what's going on within our mental health system, because it trickles out into our community and impacts the response law enforcement has to very volatile situations. And we're training our officers as best we can to deal with these situations, as Ben said, in a really trauma-informed approach, but we can only take it so far.
I'm just going to add a couple of things. First is, Matt and Chad probably have spent hundreds, probably 500 hours working on this issue over the last 5 or 6 years. They've been the leaders in our community on working through all of the issues around emergency detention and medical clearance. And, so I just want to make sure, I think we've talked about this before, but I'm going to just make sure that I express this again, which is the issues that we're having right now in regards to medical clearance and the impact it's having on people in our community. And that is, when we when we take somebody in emergency detention, and they're going to go to either Winnebago or North Central Healthcare Crisis Center, they almost always, almost 100% of the time, need medical clearance. And they're very specific tests. For Winnebago, they're pretty extensive testing that's required. So we have to take them, a law enforcement officer takes the person in crisis to Aspirus or St. Clair's, and they need to have a number of tests done so that they can go to Winnebago or North Central Healthcare. And the problem that we run into is some people refuse consent to medical clearance. And so when that happens, what we used to do is we would draft a document, which is called an order to treat. It's similar to a subpoena or a warrant, and it's a judge reviews it, and they decide to sign, and they can sign off and say, doctor, I'm signing this as a member of the judiciary, and you have the authority to treat this person even though they're not consenting. And that's a long process. Medical clearance can take hours and hours and hours of time with a person in crisis and a law enforcement officer in an ER. What we're experiencing right now within the last 3 or 4 weeks is the public defender's office went to the judges of Marathon County and said, we don't think you have the authority to assign an order to treat. And the judges said, okay, well, we're not going to sign them then. So now the problem that we have is a doctor is not going to do tests for medical clearance without an order to treat when somebody's refusing consent. And the Winnebago North Central Healthcare won't accept the patient into their facility without that test. So now we're at a standoff. We have a police officer who has a person in crisis who can't get the medical tests they need to get admitted into a place where they can get help. And so either we wait it out and the person finally relents and consents to medical clearance protocols and the testing, or we wait long enough where there's no longer an imminent threat to their safety, and we can release them, and we have a lesser, we can take them home. We have a safety plan in place or something like that. But that is the worst thing for our community member who is in crisis, who is suicidal, who's having mental health issues, and they're sitting for hours and hours just waiting with a police officer. It's just a terrible thing for our community. So I was at a chief's meeting earlier today near Superior, and I asked the room, I said, this is the issue that we're having, and I laid it out. I said, are you guys having this problem? And it was crickets, like, no, we're not having this problem. So I don't know what it is about Marathon County and why we're having and struggling with these issues, but we're working with North Central Healthcare to try and resolve these issues. For what it's worth, Marathon County Corporation Council, who has been, really involved and helpful in this process for the last 5 or 6 years. Their opinion, the Corporation Council's opinion, is that the judges do have the authority to sign an order to treat. So we've got conflicting legal opinions, but we're trying to work through it. But it's a major problem in our community right now that we just need to resolve. But I don't see an end in sight right now. But we're working on it daily.
I want to add just 2 things to that. Number one is I had a meeting with representatives from Walworth County today. And talking with their chief deputy a couple days ago, the longest they've had to sit with a person at the ER waiting was 24 hours. And Bayfield County, on the other end of the state, is experiencing the exact same thing. So although the police chiefs may not because of municipalities, their hospitals, whatever, I can tell you that sheriff's offices in the state are having the issue, and we do plan to address it, and we've got a plan of what we want to try to accomplish here in order to address it. The other thing I want to say is, to these medical clearances, our deputies have experienced a number of times where people who are in crisis, they want help, they're more than willing to go with you. The minute you go and say, we're going to go get medical clearance, well, who's paying the bill? Guess what? They are. Thousands and thousands of dollars because we're going to the ER, and they're running very expensive tests. And that falls back on the person that's in crisis. They don't need the extra stress. So there needs to be change. There is no law that requires medical clearance. That's a policy decision. I think that's very important. Nothing mandates that we have to get medical clearance. You're not going to find it anywhere in statute. So these organizations mandate it, and they're putting the burden on people in crisis. I know that's a different topic than what we're here for, but I think it overlaps with what your police officers are seeing on the street and the tensions that are boiling over, not only in Wausau, and we're very fortunate here, don't get me wrong, but you're seeing across the country is mental health plays a role in so much of what's going on.
Not because Chad hasn't done a good job, but maybe if we could kind of wrap up with Chad, because we've got one more speaker tonight, and we may bring you back.
I'd be happy to come back.
Anything else you'd like to add?
No, and I'd take any extra questions if there's anything else you've got before I walk out, or I'll stick around.
I just want to say thank you, and that is important, and like you said, it all overlaps, so it's important to know what officers are dealing with and how we can hopefully try to come together as a community to help you.
Thank you very much.
Thank you for your presentation, and
Thanks.
I imagine we will be in touch relative to some of the issues that you've raised tonight. And
You know
if
how to
there's-
find me.
I do.
All right, thanks.
Thank you. So we saved the best for last. Laurie, would you like to come up? And we apologize for making you wait, but you're probably used to that, having worked with Chad before. And
Yeah. When I saw I was following him on the agenda, I packed a lunch. No, I'm just kidding. My name is Laura Yari. I'm the Justice System Coordinator for Marathon County. My position is within Marathon County Administration, and my position has been around since 1994. This position was created due to issues with jail crowding initially. Back that year, the county had an estimate that they needed to build a jail with like 480 beds, I think, and that was back in 1994. And they made a decision that they were not going to do that, and they started looking into ways to reduce the jail population through alternatives. So that year, the county started the first Criminal Justice Coordinating Council in the state of Wisconsin, and they created the coordinator position to begin working towards implementing diversion programs that over the years have gone from not just looking at jail crowding, but also looking at dealing with mental health and AODA services, best practices for keeping people out of the system, that and using the resources more wisely. So what I did, because I don't know if a lot of people realize how many diversion programs there are, I've been with the county for 18 years. Prior to that, I worked for Attic Correctional Services.
Ben, there's one up here if you'd like a copy.
Prior to that, I worked for the agency that provided services. Chad, you want one? Chad's probably seen this 100 times, but
Ben, there's more up here. And
yeah, Chad knows the programs. So I have been with justice programs in one capacity or another since 1997. So a lot of these programs, I've been around, at the startup and how they've evolved over the years. So the very first program on the list, and I'm just going to do a high overview of the programs, and if there's a certain program that you want more detail about, I can come back and do a specific presentation just on a certain program, because there is a lot. So the community service program was one of the first programs that was started, and that was intended to alleviate jail crowding. A lot of the things that Chad talked about, probation sanctions. So some of those situations where the individual was caught out drinking and they're not supposed to be drinking, they have a probation agent has the option to refer to a community service work crew So we have crews every weekend and then twice during the week that are supervised, and they go out and do community service projects for nonprofit agencies and governmental agencies. They have a red van that they travel around. They do a variety of different projects, and that is strictly can be as a sanction from a probation agent. We've also incorporated using those as sanctions for our treatment courts, which I'm going to talk about later. One of the other primary things that the community service program was used for, and still is today, is for fine work-off. So years ago, and I do believe there are still some counties that still do this, if individuals were not paying their fines, they would be picked up on a warrant, and they would be placed in jail, and they would have to pay their fine to get out of jail, or they could sit in jail and get credit for $25 a day towards their fine. So that seemed crazy. And, you know, we're paying for the person to be in jail, and we're crediting them. We're not getting anything out of the fine anyway. So there is a person up in the clerk of court's office that receives the hours that are completed by the participants in the program, and they pay them, I want to say it's like $8 an hour to do community service work, and it comes directly off their fine. So the community is getting a benefit out of it, and the individual is not ending up incarcerated because they're unable to pay, and we're not using jail time in a very unwise way. Other ways we use the community service program, a lot of our other programs are diversion programs. Sometimes part of their diversion agreement is they do a certain amount of hours of community service. So this community service program deals with low risk or high risk. Low risk people are typically assigned to an agency within the community, and they have a work agreement, and the agency turns in their timesheet for their hours that they complete. The higher risk individuals are typically on the work crews where we have a staff member that takes them and supervises their work. So there are several ways that we use the community service program, and it's been around a long time. That was one of the original programs, so the 1994. And they have a lot of different agencies that they do projects for. The next thing on the list is the system-wide assessment. And this has been fine-tuned over the years. Right away, justice programs started realizing the importance of assessing people who are coming through the system to see what their risk level is, what needs they have. So National Institute of Corrections talks about the criminogenic needs. It's what about that individual causes them to continue participating in criminal activity, and how can we address those things? So some examples can be antisocial peers. It can be unemployment. It can be criminal family. So there's a variety of different things that lead people into the criminal activity. So this assessment, we call it our justice system assessment, and it is mandatory for anybody to be considered for one of the justice programs. So anybody who's interested in any type of a diversion program or treatment court is required to take this assessment. It helps us screen for what level of programming people are appropriate for, what their needs are, what their motivational levels are, whether they need a mental health assessment, a drug and alcohol assessment, tells us what their risk score, what if they have a lot of strengths, how motivated they are, tells us a lot of things. And that was actually an assessment that we had created by Bill Woodward from the National Institute of Corrections. He came here locally and helped norm our numbers and created our guidelines for us as far as decision making. And we continue to do those assessments on a large number of people and track all of that data so that we can see if our mental health people, screening out as needing a mental health assessment, if those percentages are going up, those sorts of things. Day reporting is another one of our very first original programs, and this is simply a a program that is open every day, holidays, weekends, mornings and nights. It's operated on a color code call-in system. This is also a program that services a lot of our other programs. So if somebody's on a diversion agreement and they're not supposed to drink as part of the agreement, we can have them come in and day report on a random color code call-in to just check up and monitor their progress. Somebody who's out drinking on probation, their agent, instead of, way back when, they would give them a 5-day jail hold if they're caught drinking when they're not supposed to. Day report can be used as a sanction. You can report to day report for 2 weeks or however long the agent wants the person to report. Day reporting is built into our treatment courts so that there's accountability and treatment working together. A lot of individuals like day report. Those individuals who are very sincere about remaining clean and sober say it's very motivating to them to know that somebody's watching, to know that they're going to be checked. We've had individuals agree to continue voluntarily day reporting after they're told they don't have to anymore. And most of our treatment court participants say that that is a key it's a key thing that keeps them sober, especially initially when they are struggling, knowing that there's that accountability. The day reporting program also, we do some condition of bond, pretrial monitoring, so somebody can have a bond condition that they have to report for testing. It's worked into the majority of the programs. Not everybody gets testing. We have criteria of, who gets testing and who doesn't. And we're moving to a system of using it mostly in coordination with treatment, because we know that if somebody is addicted and they're told to stop using, but they're not getting the services they need to stop using, it doesn't make sense to continue testing them to say, you're still using. So we are making much more of an effort to link people with services to help them stop than to penalize them by catching them. Intensive supervision, also called the SSTOP program. This is a program that we started in 1998, and it was originally funded by the Department of Transportation, and it was designed to initially supervise OWI second and third defendants in the community while they were awaiting their court process. And what we discovered very quickly is that we weren't doing a very good job of getting people to completely comply with the court orders regarding their OWI arrests and convictions. So when I first started in my position, we discovered there was a big problem locally with getting people, when you're convicted of an OWI, you're supposed to get a traffic safety assessment, and it's done over at North Central Healthcare, and it's required by law. You're court ordered to do it. And we discovered that 30% of the people, and I actually found the old data tonight, in 2002, 30% of the people never even called to schedule an appointment. So, and then you had the next step, which was harder to verify because I didn't have releases, to get their treatment information. But if 30% of them never scheduled an appointment, I could guess that probably there was another significant portion that never completed all their treatment or did all the classes that they were supposed to do. And so I started actually calling individuals to find out why they didn't comply. And there were a variety of reasons. A lot of them were financial. It's very expensive. You have to, within so many days of being sentenced, you had to come up with a couple $100s to schedule an assessment. And then after your assessment, you had to come up with several hundred more dollars to be able to take the class. And these people didn't have driver's license to get to the places they needed to get, and the classes were held when they were working. And so we quickly realized that the whole system was set up where it was very difficult for individuals to comply, even individuals who wanted to comply. And a lot of them just stopped dealing with it because it was so stressful. So that we, instead of just providing supervision for these people and catching them not doing what they're supposed to, we decided to put things in place to help them accomplish what they needed to do and to give them incentives to follow through on everything. So the SSTEP program has now turned into a program where individuals can agree to participate pretrial. We give them a voucher to get their traffic safety assessment done right away. When they pay their fine, they make payments back to pay off their assessment, but it makes them eligible to automatically get that assessment and begin treatment or services that they need. And they do it while they're still in the pretrial stage, while they have a case manager helping them. It makes it so the treatment is received very close to the time of their arrest. It's not a year later. They're given help with what they need to do to be in compliance and to get their license back. And if they need a device put in their car, they're assisted with all of those, requesting a half-price interlock or getting a proper insurance, the things that people generally just aren't, wake up and know how to do it all. So they get a lot of assistance to make sure that they have a better chance of complying. And in exchange for that, they get a significant reduction in their jail sentence and their fine. And so it's a win-win because they do what we want them to do. They get the treatment, they get their license back to drive legally again, and we save jail beds. It's been a good program. It's been going a long time. We typically save anywhere from 10 to 14,000 jail bed days a year just on SSTOP reductions. So probably 10 years ago already, the legislation put it in place where if the individual participates in an SSTOP program, the judge can give them under the mandatory minimum jail sentence. So they're saving a significant amount of jail time by following this process. So. Volunteer in probation. Oh, I also wanted to mention SSTOP. They also work with operating after revocation, the individuals who keep driving without a license, and try and help them figure out how to dig out of the very large hole that can become, and work on setting up payment plans for fines and transportation options, trying to get those offenses turned around. The district attorney's office has been doing a lot of deferred prosecutions, basically leaving those open and saying, get your license back and stop driving without it, and we'll, dismiss it. So that's been working well too. So volunteer in probation is another 1990-something project that's been going on. This was our original diversion program. And it's actually a statute that allows for the district attorney to craft agreements with individuals called deferred prosecution agreements, where they actually never charge the person, or a deferred entry of judgment agreement, where they do charge the person, but as long as the person cooperates with their plan and completes all the activities that they're assigned to do, their charges are either dismissed completely or lowered to a city ordinance ticket. So this program has been around a long time, and it traditionally dealt with very young, first-time, low-level individuals, and they typically did community service hours, maybe wrote an apology letter. If they owe restitution, they come up with an agreement to pay that restitution back. They might have to do an education class of some sort. But the plans are set out ahead of time. They agree to do it, and once they're complete, then the DA's office follows through on whatever arrangement they agreed. So this volunteer and probation program is a wonderful opportunity for a young person to avoid having an adult final criminal record. Especially the deferred prosecution, so that it never shows up at all on CCAP. As you know, everybody's record is there, and that those convictions can impact people's lives long after, they age out of that situation. Then the domestic violence volunteer and probation, this was an offshoot of the volunteer and probation. So the domestic population didn't really fit the VIP statute. Some of them were older, some of them had a little bit higher risk level. But yet we had a problem where individuals were not to the level of needing formal probation, but the courts wanted those individuals to complete domestic violence intervention, such as the SAFE program or other counseling. But without putting them on formal probation, there wasn't a way to ensure that they got those services. So what we started was a whole nother track of volunteer and probation that was strictly low-level, first-time domestic violence offenses. And the district attorney's office would refer those cases over for case management. The case manager would follow up with them and make sure that they completed all their programming, report back to the district attorney's office, and then the district attorney's office would typically lower those down to a municipal disorderly conduct. So the same theory as the volunteer and probation, it was just that we had a very large number of specific domestic cases that we actually have an entire track just for that. The diversion program was the third, the third offshoot for diversion programming. And that came about because we saw a significant amount of people who we knew had those AODA and mental health problems that were leading to their criminal activity, but they were a little bit deeper into the system, maybe had some previous convictions or things going on, and they needed more intensive interventions and more time with them. And they didn't fit the VIP statute, and the district attorney's office made a commitment to digging in a little bit deeper, doing diversions with people who had some more significant mental health and AODA issues, and giving those opportunities for those individuals in exchange for a reduction or, not charging that they complete treatment. So it was motivation for the individual to get the treatment that they need, holding that case open, and trying to pull people out of the criminal justice system by getting them the services that they need. When this program was created, there was a position created in the district attorney's office, which Teresa will probably talk about. Ruth Heinzel is the diversion coordinator, and they divert 700-800 cases, a significant amount of cases between all the different diversion programs every year. Let's see. Next, we have the treatment courts, and there's the OWI treatment court, which is for 4th, 5th, and 6th OWI offenders. And then there's the drug court, which is for high-risk, high-need, prison-bound drug users. These programs run the same. They're run using the National Drug Court model. So Marathon County made a commitment back in 2009 when we started down the road of treatment courts. We applied for a training and traveled as a team to Springfield, Missouri for a week to learn all about the treatment court model and to be able to implement these courts in an evidence-based manner to make sure that we got the outcomes that most drug courts see that run under that model. Then we applied for a federal grant, and the Bureau of Justice Assistance gave us grant money to start our first treatment court, which was the OWI court. So there is a National Drug Court Association website, which you could read for days and days and days about drug courts and their effectiveness and their models and what the premise is. But in a very condensed version, a treatment court combines treatment and accountability. So lots of research out there that says accountability and punishment alone don't work. Treatment alone don't work. They need to work together. There's a lot of research behind the model's effectiveness as far as the team approach. So it's the justice system working together to help the individual in the court. So we have judges, prosecutors, defense attorneys, treatment providers, probation agents, case managers, social workers, law enforcement, and the teams meet weekly, and they discuss all the people in the treatment court. People receive services, they see their agent weekly, they see their case manager, they get programmed, they get assessed and programmed in treatment, whatever level treatment they need. We send people to residential treatment if that's what their assessment calls for. We don't turn anybody away from mental health, so we provide significant mental health intervention, help people get stabilized on medication. I have become a pseudo landlord with renting apartments for sober living so that these individuals have a place to live. We allow them to live in the apartments while they transition back into the community, get a strong start in their treatment, give them some time to look for work. We get them introduced to the recovery community, have them get a sponsor. We require them, if they're not working, to do 20 hours of community service a week. If they don't have a high school education, we work with them to get an education completed. So it is a full wraparound, very intense program. And the individuals that come into this program are very deep end of the pool. They have significant criminal records, significant drug and alcohol, mental health issues, and long criminal histories in and out of the system. So the county, back in 2009, had asked me to find something to do with those individuals that are frequently coming in and out and taxing both the jail and the mental health AODA system over and over and over again. And we have had very good outcomes with this population, better than the national average that we expected. And we have quite a significant population of graduates that are sticking around and helping new people coming up through the program. So it's been going very well. We have the ability to serve up to 25 individuals at any given time. And the minimum time it takes to complete these programs for OWI court is 13 months and drug court is 14 months. And I think there's maybe 1 or 2 people that have actually managed to finish in that time frame, because if they have relapses or violations, their phases and things can start over. So they have a phase system that they have to achieve certain things in order to progress in the program. Our drug court actually gives priority to individuals who have children in out-of-home placements. So when we first started the drug court, our social services the same year had come and asked for additional positions to work with all the children who were being affected by parents with drug and alcohol issues and that had been removed from homes. So I know as of the end of last year, we had reunited 10 children back to their parents that were out-of-home placements. So we do give priority to those individuals. The drug court is relatively new. OWI court has been going since 2011, and drug court is on our third year. So let's see. Did I skip something? Oh, case management and treatment services. So that is our treatment program. We had a really hard time finding evidence-based offender-specific treatment. It was a real conflict when we started our treatment courts to find treatment that met the intensity level in the community that these individuals needed. These were not people that could go for outpatient counseling once or twice a month. These are individuals who are spending a significant amount of time. They call it dosage. So when we created the case management and treatment services, we partnered with the Department of Corrections, and they pay for half the program and we pay for half the program. And it is an evidence-based program that uses all cognitive curriculum designed for offenders. And it is designed to provide dosage hours needed to, according to the research, change offender behaviors. It is a program that is for Department of Corrections primarily. Other people would be eligible to get into it, but it's typically, in order to reach the level of dosage, it's typically our treatment court people or some of the higher risk probation individuals. So that program is operated over at Attic. It is, they have duly certified clinicians that are mental health and AODA. Their clinicians are part of our treatment court teams. They work closely with probation agents. And we're currently in the process of determining how we're going to get that CMTS program to work as the treatment option for a new housing program that the Department of Corrections is attempting to start. So they have put out a request for proposals for, I believe, a 10-bed house that will then, the people living in that house will get their treatment services through our case management and treatment program. Okay, and then pretrial. Pretrial is the newest initiative, and pretrial came out of our work with the evidence-based decision-making project. So back in 2015, the state of Wisconsin was working with the National Institute of Corrections, and they put out a request to the counties asking who would like to participate in this process. And I believe there were almost 50 counties that applied, and they chose 7. So Marathon County was selected, along with La Crosse, Chippewa, Eau Claire, Rock, Waukesha, and Outagamie counties. And what we were getting ourselves into was a process of looking at our system, looking at the map of how somebody moves through the system and all the different decision points, and making sure that we are using evidence to make decisions. And as we looked at what we had implemented, we saw a glaring problem across all the counties with the decision of bond. And with the movement across the country dealing with cash bond and getting rid of cash bond due to it being seen as unfairly punishing people who don't have money, there have been many jurisdictions around the country that have been sued and had to stop using cash bond without any plan for how to make decisions without that. So we started down this very long road of looking at an assessment to put in place at the bond decision-making that would help, an actuarial tool that would help give a judge information on every defendant that comes before them that measures that person's likelihood to return to court and likelihood of committing a new crime consistently on the same data points. And so the Laura and John Arnold Foundation had been doing a lot of research on something called the PSA, the Public Safety Assessment. And it is an assessment tool that they had done years and years of research on, and it does not require a meeting with the individual. It's based off of 9 questions that, through research, they determined directly correlate to the likelihood of coming back for court and the likelihood of committing a new crime. And so it's kind of like when you get car insurance. If you're male and you're 16 and you have a speeding ticket, you're going to get charged more than if you're married and have no speeding ticket and you're 30. Because statistically, they say a 16-year-old is more likely to cause a claim. So it's the same premise. It looks at whether they had open charges at the time they were arrested. It looks at their current age. It looks at whether they've failed to appear for court in the last 2 years or ever in their lifetime. Looks at how many misdemeanor convictions, how many felony convictions. And it puts a systematic number on that individual in looking at the same exact things in every person that comes before them. So it gives them a failure to appear score and a new criminal activity score. And it's not designed to tell a judge what to do. It's designed to let the judge evaluate that individual in front of them the same way every time somebody comes before them. And then they listen to the defense argument, they listen to the prosecutor argument. It's just another way, another piece of information to help them in that decision-making. And then we had gone live with circulating those assessments. And then we have assigned levels of supervision that go with the outcome of those assessments. So every day in intake court at 2 o'clock, the judge does the initial appearance, and if the individual before them is a level 4, they will craft the bond to include level 4 supervision. So level 4 supervision is the highest pretrial supervision. It's where they're getting weekly face-to-face contact. And we cannot force anybody to do any type of services like treatment or mental health, but we are offering resources and helping people voluntarily connect to services, helping them in all areas, not just mental health and AODA, but housing, education, employment, basically any type of improvement that an individual would need. Those individuals also, a small number of them will be drug and alcohol tested if their substance use is a direct public safety issue. So 5th, 6th OWI, they're going to get random testing to make sure that they're not drinking. Every violation is not going to be responded with pulling them back in jail. We have a whole behavior matrix of how things will be responded to. Case managers will have discretion to do community service, to increase testing, to increase face-to-face visits, to have a conversation with the individual and say, listen, you have a condition of bond not to be using, and you seem to be struggling with continuing to use. If you continue to use, eventually it could lead to you being incarcerated again. Would you like to explore this issue? Would you like a referral to somebody who can help you? So trying to be proactive instead of gotcha. And I mean, that's the point of it, is not to catch them and send them back. It's to catch them and help them get back on track. So, and that is actually last week was our first week of go live. So it's been pretty busy. It was a significant lift to get this up and going. The case manager and the assessor have quite a chore because people come into the jail and they're appearing by 2 o'clock. And so they have to get the list of who's going to be there. They have to comb through national and local backgrounds. They have to score these assessments, get the reports written up, get them circulated by 1 o'clock so the judges and attorneys can see them before court. And it's quite the process behind the scenes to get everybody working together. But so far, our first week was smoother than expected, so I hope it continues that way. And I think they already have like 10 or 11 people who have gone over for intake and started the pretrial supervision. We've also talked about reaching into the jail population for individuals who have been sitting for a while and have not been able to meet their cash bond, and looking at if the pretrial supervision that's now available would be agreeable to a judge to modify their bond to let them out under supervision. And we are working towards implementing electronic monitoring, working with the sheriff's department so that if there are that large number of people that are sitting that could be properly supervised, trying to look at getting some of those individuals out. Everybody at pretrial is innocent until proven guilty, and release is assumed unless there's a significant reason for public safety or, not appearing. So that is our next step after we get this process ironed out with referrals and getting people into services, is to take a look at some of those individuals that are sitting that may, or, a judge could consider a modification. So that was a really high overview. I mean, the treatment court model stuff, I could talk all day, so any questions?
So at the end of the day, how many people are diverted through these programs? Do you know?
Thousands? Yeah, wow, just, I mean, community service itself probably has 500 a year. We're doing probably 1,200 assessments, system-wide assessments. Day report typically has a couple hundred people at any given time. Intensive supervision has 2 full-time case managers that they can serve, 120, 130 people at any given time. The volunteer and probation and the diversion, they all serve probably 60 to 75 at a time. Those diversion agreements are 6 to 9 months. The treatment courts average about 30 people a year as people graduate and come in. Case management and treatment services, I think there's 80 right now that are being served. Pretrial, yeah, who knows? Because as the courts start to move again, and we're only right now assessing people that are in custody, and they haven't been bringing a lot of people in custody. So in a way, it's been a good thing to try and start right now, because I remember days when Mondays had 30 people at intake, and that would be kind of overwhelming. Pre-trial, we have right now the case management in place for like 140 people. And depending on how quickly the courts get moving and close out some of these cases, it's just really hard to gauge with the way things are right now with the pandemic. And then Ruth in the DA's office and her assistant, they case manage a caseload as well. So they have a few hundred more that they have over there.
Pat?
Yeah, thank you for all that. Who's doing all the supervisory work? Is there a little group of employees that you work closely with, or is it mostly the DA's office, or
Well,
who's getting this done? It sounds mammoth.
it is. So I am the only county employee in justice programs. Ruth is actually an employee in the DA's office, and she has another full-time assistant in the DA's office. I am the contract administrator for all the services. Most of our services are contracted through Attic Correctional Services. They are over on Jackson Street now, and they have a large office with a lot of staff that are doing the feet-on-the-ground work. And some of their staff are in the courthouse as well. Our treatment court coordinators, our justice system assessor, and our pretrial assessor are all in the courthouse, but they are Attic employees. And so they have a supervisor, Sean Yeager, over there, and I'm the contract administrator for all of the programs.
Other questions?
And thank you for the presentation. I was wondering, 'cause, I mean, it looks like a lot of great programs, but some are much older than others. How is success measured? Or is there reviews of these programs to see if some are working really well and some are not?
Yes, so some of our older programs, we have not had recent evaluations on, and we are actually at the CJCC level working on creating a dashboard. We're working with the university project to come up with, measuring what matters. Part of our dilemma is that different things matter to different people. So, for instance, our SSTOP program. The treatment providers want people to not be drinking, not be driving under the influence, improving their quality of life. The DA's office wants them not to come back through with any new charges. The state wants them to complete their traffic safety plan and get their driver's license back. And so the county enjoys the 10,000 jail bed days a year that we save. So we are, as a council right now, doing some work to put some benchmarks in place, because program evaluation is huge, and I don't have a huge budget. So we want to create dashboards that we're going to decide what indicators we're going to track that help us determine if we're on track with what we hope to accomplish. Our treatment courts, especially our drug court, that's a TAD grant, and we enter all of our data into their database, and they monitor our performance. Our OWI court was the same way when we had a grant, and then we did have an evaluation done on it. And we do track recidivism rates as far as graduations from the program and how they stay out of criminal activity. Like our graduates that have hit the 10-year mark, there were 6 of them that graduated the first year, and 5 of the 6 have no criminal activity of any kind in 10 years. And I'm knocking on wood, because every time I say something like that, it comes back to haunt me. And those are individuals who had 5 and 6 OWIs. And some of them had significant criminal records on top of it. So, and actually one of those graduates still comes back to all the graduations and congratulates the graduates coming through. So we tend to build a very tight network of recovery for them, and we're able to keep track of them. Our drug court has been more challenging. Methamphetamines and keeping people, and a lot of them are younger, more ingrained in the criminal activity. But our numbers are still better than nationally what's expected. And I do have some numbers, but I didn't bring them all with me at this point. But our numbers are still above the benchmarks that we would expect. So that is a much tougher population. Our OWI court seems like a walk in the park compared to the drug court. As far as the other programs, community service, we track stuff such as the amount of dollars of fines worked off, jail days saved, hours of service to agencies in the community, system-wide assessment. We track all of the outcomes and, the percentage of people that score out as needing mental health or AODA and risk levels, and we track all that. Day reporting, we basically keep track of, how many people are reporting, how many positive tests, what they're testing positive for. Sometimes that's helpful, to determine drug trends and what people are using. As STOP, it's the jail bed days and the traffic safety plans completed and the driver's license reinstated. Volunteer and probation and diversion. Ruth does a really nice job in the DA's office tracking that, and Teresa probably will present on some of that. She does a really nice job of following people and their outcomes. Case management and treatment services, we report every hour of every type of service individuals receive. They do knowledge tests when they come into the program, and when they graduate, they do like a quality of life survey at the beginning and the end. They do recidivism follow-up on those individuals. So they look at both recidivism and quality of life for that program. So I actually get a 24-page report every month from the agency that gives me more data than I would ever need or want. And so that's what we're working with University Project in, is we want to spend less staff time collecting data that doesn't mean anything and more time collecting meaningful data. Because we collect a lot, it's just that I don't know that we need to collect everything we do, and maybe there's something we'd be better off collecting.
Pat?
What have the challenges been in convincing people that you are actually there to help them, and you have a lot of options that they can pursue. And has that convincing become easier over the years as people who are coming to you maybe have friends, associates that have heard good things about the program? Is it the people coming in have a kind of a good sense of it? Because I would think the first thing a lot of these folks would think is, how are they trying to screw me now?
Yeah. Justice programs aren't typically the ones that are seen as, you know, the enemy. We tend to be offering them some sort of a good deal. I would say the whole culture all over has changed. So when I first started, a long time ago, people went to jail for everything. I mean, you had a positive test for alcohol, or you were spotted in a bar, or you had smoked marijuana, you were in jail. You didn't show up for treatment group, you were in jail. And I think, you know, the Department of Corrections too has been working to make a huge shift into focusing on substance use and mental health and public health issues, and offering people treatment and more supports. But it is a hard shift, especially for some of them who've been in the system a long time. And I think where it's most evident is in treatment court. It takes us a couple of months before the individuals in the program realize that it's okay to tell us that you relapsed. It's okay to tell us that you used. It's okay that you screwed up. Just don't lie about it. So that's part of the drug court program is relapse is acceptable. It's something we can work on. Lying about it and being deceitful is not. And so the first several months of the program, it's getting them to the point where they will trust that they can be honest that they're struggling and that they're using and they're not going to go to jail. You know, now we'll have people come in and they'll say, well, I'm going to be positive for this because I used. And they'll tell us beforehand even. And so it's working on that rapport, and we're here to help you. We did a roundtable on an individual today who was struggling. And what a roundtable is where the whole team meets with that individual and asks them what their struggles are, what we can do to help them be successful, gives them a chance to basically talk to the team and, you know, make the individual realize that the team is there to help them, not to catch them. So it's a huge shift, and it takes time, and some are more trusting than others. But overall, I personally have never been one that people think I'm out to get them. I get a lot of the, you know, law enforcement says I'm the one that lets people out. And I tend to get the calls. The defense attorneys say, well, call Lori Yari and see if there's a program or something. But I think it's a shift. And I think, too, law enforcement, it's been a big change. We have law enforcement on our treatment court teams, and they have been supportive and therapeutic and you know, trying to build rapport with individuals that way, too. So
I would say anecdotally, so it was 20 years ago that I was sending lots of people to visit Lori and her staff at Attic. And, you know, I'm sitting here reading and learning about these programs and where they've gone. And I will be honest, I had 10-day holds for all the time. And but the Department of Corrections as a whole has shifted their viewpoint, and I think that is a major help. And so I do see a lot of progression.
absolutely.
So, I mean, I don't know how many times I was there picking people up that were positive on Thomas Street, you know, and because you called me and say, we've got a positive PBT, and that's what we did.
Yep.
And so we changed the mindset, and I think it's really cool to see what's happening.
Is your mic on?
I think I turned it off, actually. Sorry. So I know we're running a little long. I have one other question, though. You had talked a little bit earlier about, when you were talking about sort of the OWI program and individuals were meeting it, and some of them were due to financial ability. Now, in terms of, I guess, the programs that are out there where people have to pay, what are the options for people who really don't have to pay? Because some of them, when they go in jail, they lose jobs, didn't have a stable job to begin with, but really could benefit, but really can't afford. So what are their options?
I would say that over the years, I don't allow people to be declined for inability to pay. So there are sliding scale rules in place. They bring in their financial information, and we use a similar scale to what the healthcare center uses. People are not declined or not allowed to participate because they can't pay. Now, that being said, there is a process which I don't have control of that has been maddening to me over the years, and that is the state mandated system for OWIs and being tough on OWIs. And basically what they have done is they have created a system where I would love a researcher to tell me what income level you would have to actually afford to do what you're supposed to do after getting an OWI. That's what I want to know. Because when you get an OWI, even if you don't hire an attorney and you plead guilty, you're going to end up with a significant fine that you need to make payments on. Then you're going to pay a couple $100s to get an assessment done. Then you're either going to have to pay several $100 more to take a class at the technical college and buy the book, or you're going to have to go into treatment. And if you don't have health insurance or you have a huge deductible, you got to pay for that. If you have a BAC that raises to a certain level, you might have to pay to have an interlock put it in your car and a monthly fee for that. And so, as you can see, that's just a first OWI. So there's a certain amount of income you have to pay for all that, and you have a certain amount of days to do it. And then don't forget that we live in a very large county, and there isn't really good public transportation. So your car insurance is outrageous. So you have to pay to reinstate your license. You have to pay for an occupational license. Otherwise, you get more criminal charges if you don't pay for all those things and do all those things. And then, heaven forbid, if you were to get more than one, you could then end up paying jail fees. You could end up paying lawyer fees. You can pay probation fees. If you sat and added up, and that's part of why our SSTEP program transitioned, because I said, do we want these people to not drink and drive and be law-abiding, or do we want to punish them and drain every cent out of them and cause more stress? I mean, what is our goal here? And ultimately, I think what everybody wants is for people to not drink and drive and not injure people. So these statistics from 2002 that I found, so 2002 calendar year, I looked at everybody who didn't call to schedule their assessment, and there were 229 people. So right there's 229 people that don't have a driver's license anymore after a certain amount of days if you haven't called to schedule. And so by June of the following year, I background checked all of those people to see where they were at and what they were up to. And within 6 to 18 months, because it would be 18 months if they were like the beginning of the year, and at the end of the year it would have been 6 months, I was able to find 118 of them, and 92 of them had a documented new offense already. And 32 of them already had a new OWI, and 78 of them had a charge for operating after revocation. And then I took it further and I said, of those 92 people, what types of new crimes did we accumulate? We had 104 new operating after revocation arrests, 8 new operating after suspension, 35 new operating while intoxicated arrests, 4 open intoxicant arrests, 3 hit and runs, 5 underage drinking arrests, and a new homicide by intoxicated use of a motor vehicle. So that was between 6 to 18 months for those 92 people.
Well, sure, because then you can't afford to pay for the services that you need for help, can't afford to get your license, and you can't afford to get a job, or if you do, basically you're gonna get caught, right? Because, and that's what I've seen before in terms of people getting right back on the road because they gotta go back to work, and there's
Right.
no other way.
And they're driving without insurance because they can't afford it.
And no transportation, reliable transportation in a lot of places, so it's
Yeah,
the
it's a
unfortunate
big
cycle.
trap that when people get dug into that, it's very hard to get out. And even if you intended to be pro-social and do everything you were supposed to, there is a significant portion of the population, there's no way that they can afford to do what they're supposed to do. And so they don't, because it's easier, the path of least resistance, just ignore it and keep driving. There were all sorts of issues. There was, the class I need to go to is Monday night, and I work on the road, and I leave with my crew, and I have no way to get back and take the class. I can't pay for it. I have no way to get there. You name it, I heard it all. And so we tried to put things in place, and we're the only county in the state that offers that voucher program where they can get their assessment right away and reimburse the county. But yeah, it's a significant problem. And the research says at the state level, I sat down in Madison and listened to a presentation where they talked about how successful all the people are that complete this traffic safety plan. And I thought to myself, well, yeah, because they're the really motivated high-income people. Well, how does everybody else do, if you're only looking at the people who manage to get through all the hoops?
Sorry, Elad. One. Go ahead. I always just like to ask as well. Again, policy board. In terms of task force, is there anything that you would like us to know in particular, or think that we maybe could help with or highlight in terms of moving forward, in terms of this task force?
Well, I can say that there's one thing at the city level that I know Ruth and I have both struggled with over the years when it comes to fines. And there are a lot of municipalities that are taking away people's driver's license if they don't pay their fines. And it's very problematic because they continue to drive and get more fines. And that's one thing. It's just helping add to the, and I know years ago I did approach the city too about getting on board with the voucher system for OWIs. If they come through the city, they don't qualify for the voucher. It's only through the circuit court. So, but again, it's a financial thing where the county's putting up the money and then collecting the fine and reimbursing. And I just think, the continued support to move towards addressing substance abuse as a public health issue instead of a criminal issue, and more acceptance for services. And sober housing, that's a huge need as well. Like I said, I made a commitment when we started these treatment courts. I said I don't want to do a treatment court and have the person leave services and go back to their drug dealer's couch to sleep at night. I need somewhere for them to live. So I actually just signed the leases again today. I rent 4 apartments. I have a house for females and a house for males that our treatment court participants utilize, so that they have somewhere to come out of treatment and have a clean, sober place to live while they try and get on their feet. Most of these individuals have burned bridges with family. They don't have any pro-social friends. So if they have nowhere to go, they go back to what they know, and that's their drug-using friends.
Thank you for those comments and the presentation.
Sure. All right.
Very,
thank you.
very informative. All right, next item, I think we're going to skip pillars 3 and 4, given the time, or you'll need the pillars to prop us up. So the next meeting, we don't have scheduled. Would the 21st work for people? It's a Wednesday night, I apologize. Not thinking. 19th or 21st, but I did talk to Teresa about the 21st, and she was available at 6:30, but we would, I think, probably focus just on the DA's office at that meeting and their diversion programs and how they're supporting the homeless initiative and other things. I think she's got a litany of programs she'd like to share with us. Would the 21st work? That's why I think we went to Wednesday. So let's plan on the 21st, 6:30, and we'll lock that in. So thank you all for your patience tonight. We are, if nothing else, we are adjourned.